Speaking of identity and how to identify certain people, well, nurses were seeking just that, their uniform allowances and a number of others that they sought way back in 2017 came to a screeching halt this year. And that is where we find ourselves. A 5-month-long strike in 2017 that resulted in a return to work formula. They went back to work. We had an election. We had a handshake. All of that. And yet this year, again, unfulfilled promises. Nurses back out of work. The court says no. And today, SRC says,
you can't afford it.
No money. We are not giving it to you. So we find ourselves right back to where we were 2 years ago. You know, to begin, again, with the issue of nurses and doctors, and their strike at some point was, you know, almost, you know, running concurrently at that time. And here we are again. And it talks really about devolution of health, doesn't it? At a time when the UHC is being piloted in 4 counties.
Absolutely. And the nurses' strike invites what I would call a Me Too scenario. The nurses will be sorted out. The clinicians will say, what about us? The doctors will also say, me too. And other health practitioners will also say, me too. I'm looking at the letter that SRC wrote, and they're saying if these allowances that are being demanded by the nurses are to be effected, it will cost us a further 3.4 billion shillings for the uniform allowances, and for the nursing service allowance it will cost us another 2.5 billion shillings. In total, 5.9 billion shillings or so. And this is also in line with the ballooning wage bill that we keep talking about every so often. But more important, is there then a need for a harmonized way of working in the medical sector? Because these are critical services. I mean, we've seen the way patients have suffered, especially in public health institutions. And unfortunately, patients will continue to suffer every so often until this matter is resolved conclusively.
Okay.
And if you don't take care of it today, next year but one, it will obviously come back. I've heard people talk about, is there a need for a health service commission to take care of the interests
and that came up during the doctor's strike. But here's the thing, though. This agreement was made during the return to work formula after the 5-month-long strike. Kai, this was agreed upon. It was even staggered. 2018 to 2019, 23,000. Right. The following year, 26,500. 2020 to 2021, 30,000. Was SRC not an influential part of that return to work formula? You know,
I think SRC, and as it has explained today, is worried about the numbers. It's worried about affordability of this offer. And this has happened before. We saw the TSC overcommitting itself some time back to the extent that it could not even be able to meet the promise in 10 years. And this is, I think, what is worrying the SRC, that, look, where do we get the money? But the other issue that may be of interest in this matter is just the structure of the health sector. Because we are saying there's a strike. Some are describing it as nationwide. It's not. There are counties that are going on well because the nurses there struck a deal with the...
Machakos, Mombasa and Migori are the ones that implemented the return to work formula agreement.
That's right. Yeah. So there is this disharmony. What formula did they use to get and to settle for the return to work formula that cannot be applied? It
was signed by COG, by the way.
Yes.
In fact, Governor Nanok, who was the chair at the time, you know, signed this off, and these were the agreements that they made.
And one wonders, if it's with the COG, why some countries are not all? I think there's a little issue about how our structures are working currently around the health sector. And very soon we'll start having this conversation again about whether health should be devolved or it should be a national function like education is.
Indeed, Joe, you're talking about this being the focus on devolution of health and whether that has been...
It really ought to be. By the time you're saying that, oh, this county is joining the strike today, the ones are threatening to join and that sort of thing, you're beginning to speak about the historical disparities that have been there in the provision of health services are likely to continue because of the different, you could say, conditions in the different counties. One, it could be a factor of management style of some governor or the other. So basically what we are saying that health, which is recognized in the Constitution as one of the socio-economic rights, that every Kenyan is entitled to a certain degree of affordable, high-quality health care, that we are actually saying that it is going to be subject to sometimes the whims of a county governor, or sometimes to the prevailing conditions in County A that might not be the same as County B. So I think to the extent that this is recognized as a right that all of us, the country should be aspiring to give to all of us, then it means that we have to have a more coherent sort of national approach to how we ensure the provision of health services to the people. So if we are going to have this being subject to all those different situations, we will have a problem. So I think that the nurses strike, the nature of that nurses strike, in my view, is the greatest testament as we speak today of what is wrong with how we have organized the management of health in the country. You cannot have fundamental issues such as health left to the masses of the counties as currently constituted, because remember, even devolution itself is still work in progress. There are a lot of things that are not working with devolution that we're still trying to fix. Governors, for example, have been pushing money going to the counties. We are not sure how the health budgets are managed. Every county sort of deciding what they allocate to health and that sort of thing. So we have to find a way of making it reasonably harmonized across the country.
In fact, Francis, the lady called Wangari here on Twitter says, she gives an example of Mombasa. She says the health sector budget is 2.9 billion. Health wages are 2.2 billion. Same story in other counties. Where's the additional money coming from? It's a zero-sum game. You cut water, cut the youth. Increasing our own resource revenues is part of the answer. Even by them, Mombasa has actually joined. They've given a notice for a strike. They've given 11 days notice for the strike because apparently the money has been withdrawn.
I think it was Mombasa, Homa Bay, and something.
Yes, that was today.
Talking about management of the health sector, I think we also need to talk about a few realities. The health ministry is one of the major beneficiaries of the national budget every financial year. Huge allocations go to the Ministry of Health. But the question is, how much money is devolved for health? Why is the bulk of the money allocated to the Ministry of Health remaining in Nairobi? Yet, health functions are largely devolved in the counties, devolved. Why? And that's why every so often you'll hear of mega scandals at Afya House. If a lot of this money that is allocated to the Ministry of Health is taken to where it's supposed to be, because the health function, the practicality of it is at the grassroots. Take the money there. That's why billions of shillings will be stolen at Afya House, yet in Kiambu District Hospital, guys are sleeping 3-3 in a bed.
And there's no dawa.
You will go to Lamu, you will go to Nakuru, you will go to Lodwar, and you will find there is no medicine. Yet every financial year, a huge amount of money is allocated to the Ministry of Health. So let's get it right there, and then we'll start getting it right.
Let me give you the example of what happened in Tanzania, because they had an attempt at decentralizing, the health functions. And what happened was that the districts were unable to attract and retain skilled workers to the degree and to the level that they actually returned some of these functions to the central government. And it's key to remember, in the health sector, there are two basic building blocks. One is management of human resource, and the other is the essential medical supplies. Now that essential medical supplies, that's under KEMSA, and KEMSA has its own issues. Let's not even get started on that. But there are some people who are of the school of thought that perhaps we devolved this too quickly, and that there might be a formula that would be different. Have some functions centralized, have others decentralized. For example, to ensure that salaries, in-house training, that happens centrally.
You see, the
happens rather, devolved.
Is how we understand this devolution. People define it, especially the governing, both the national and county government, define devolution in the narrow terms of who is boss, who is running the show. Yeah, that's not the case. It should be an issue of resources. It's about a lot of the money that is in the Ministry of Health should go to the first line in the fighting of disease, which is the dispensary.
It's also about, and if you remember during the days of the Transition Authority, what was the one mantra about devolution? That funds follow functions.
Yes.
And that was there the capacity at the level of the counties to be able to pay the staff, to train them, you know, and provide all of these services at the point. In fact, this became a political issue, as it naturally should be. You remember in 2013, when there was a lot of political pressure, you know, at the president, on the executive to devolve health completely. And so that's the thing about the capacity. It's all well and good to say all the money that is in Afya House should go to the counties, but do they have the capacity to train,
but Yvonne,
to hire?
We talk about training and hiring. We have the equipment worth billions of shillings that counties are paying for that is not being used.
That was
and one of the reasons
some say was forced
exactly, and one of the reasons is because they don't have trained personnel to be able to operate this machinery. And what does this really do to the president's one of his 4 agendas, which is universal healthcare? What does this do to that? Because as we say, it's his final term. He wants to see this thing come to conclusion. But what does this do to him?
Which is an interesting contradiction, because if this big 4 is being driven as the president's national agenda, and yet the very fundamental building blocks of that are being managed by devolved units over which the president does not have direct control and whose priorities differ from one county to another. How on earth is the president going to ensure in a coherent way that he actually achieves what he is thinking, while the governor in Samburu or in Siaya might be thinking about a totally different thing?
Think about re-election.
Which are the easiest places to eat? Security,
health,
food,
health, education,
infrastructure. Those 5. That is where the bulk of the money is.
Francis, we missed the eating.
Yes. These are the areas where a lot of eating takes place. For example, when you buy equipment and force county governments to take them, and you don't even talk about whether they have the necessary capacity to handle those equipment, whether they have the right personnel, whether they have the right infrastructure, but you're telling them, take. And then the price increases from 4.5 billion to 9 billion progressively. So you can tell where the eating happens.
And who will forget the empty containers, Francis?
They're still in Mombasa, by the way. They're still in Mombasa, those containers, 10 million shillings each. They're still in Mombasa. And the people who brought them in, they pocketed the money. So you can already tell where it is. I mean, look at the so often issues of eating that happen at NHIF. I mean, put it clearly that health, you who is suffering, the patient in Mashinani, is just being used.
And of course, because it gets a big allocation, because health is big. I mean, but obviously, I think, you know, the consensus around the table is devolution of health is something that needs to be looked at.
And we need
but bringing it back to Nairobi will be problematic.
As well.
Governors will not let go. Because this is also where a lot of
money.
Eating happens. Francis, thank you.